This presentation provides an overview of the basics of sampling in research. The term population is defined as all of the individuals or subjects that meet a particular characteristic. And in human subjects research related to health, this is often individual people. But it may be some other unit that meets a specific characteristic of interest. For example, it may include all of the hospitals in the state of Idaho, all current Boise residents, all Boise State Health Science Studies students, or all patients admitted to Hospital X for inpatient care during 2014. And if you collect data from all individuals in a population, this is called a census. And the term sample simply means a subset of the population. And looking at just a sample can be very useful in conducting research if the sample is representative of the population. And the way the sample is selected is called the sampling method. And it's important to be familiar with the basics of sampling in order to assess the quality of research. There are various ways to go about sampling for a study, and all sampling methods have pros and cons. Some are easier, quicker, and take much less money or resources to employ. Some work well with quantitative research, and some work well with qualitative research. Some are great for pilot studies to initially test out a study design, but are not good for a study aimed at establishing unbiased and statistically meaningful results. So the appropriateness of each sampling method really depends on the context and the specific research questions to be addressed. But there are two specific questions to keep in mind as you evaluate samples and sampling methods. First, is the sample unbiased? In other words, is the group included in the sample representative of the population of interest, or is the sample somehow biased in favor of including only certain types of people or subjects within the population? Second, is the sample size sufficient? In the rest of this presentation, we'll discuss some basic sampling methods and concepts. The second presentation focuses on sampling size. When thinking about sampling, the first thing to consider is what is the population. Often you'll see the population designated with a capital N. In other words, what group are we interested in researching? And a population can be defined broadly or narrowly depending on the research question. Maybe we want to learn about sleep habits among all Boise State students, in which case all Boise State students would be our population. But maybe we want to focus just on Boise State students majoring in health science, or just Boise State students living on campus, or just part-time students. Regardless, it's important to understand and have clearly defined what the population of interest is. Once the population of interest is clearly identified, researchers then need to think about and identify the sampling frame. And the sampling frame is the group from which the sample will actually be drawn. In other words, these are the individuals within the population that are available for contact to be included in the sample. And very often, the population and the sampling frame are the same, but not always. Differences between the population and the sampling frame may result in bias. Let's say, for example, you want to send a survey to a representative sample of all physicians practicing medicine in Idaho regarding their perceptions of electronic health records. So the population would be physicians practicing in Idaho. And think, in practice, if you were actually conducting this study, how would a researcher locate the names and contact for all physicians practicing in Idaho? One of the best places may be to look at the Board of Medicine and the Registry of Physicians licensed to practice in Idaho. And that would probably be a very good sampling frame, but maybe not a perfect one. Physicians employed by federal programs like the VA, the Indian Health Service, or the military are not required to be licensed in that particular state. They just have to be licensed in one of the 50 states. So this sampling frame would systematically exclude some members of the population, namely physicians working at a federal facility in Idaho, but who are not licensed in Idaho. So as you review research, Make sure you understand if there are pertinent differences between the stated population and the sampling frame. For example, hypothetically, let's say you see a study stating that a particular wellness program is effective in improving the health of university students in general. But as you read the methods section more closely, you see that all participants were sampled from only students enrolled in health education and exercise science classes. In this case, the difference between the sampling frame, students enrolled in health-related classes, and the stated population of interest, university students in general, would be very pertinent, and it may be very likely that students from different majors unrelated to health would have different outcomes when enrolled in the wellness program. Those students may be more likely to find it frustrating and drop out of the program. In an ideal world, a study published in a peer-reviewed journal would fairly and objectively state conclusions that are supported by the actual findings. But sadly, this is not always the case. And as a consumer of research, you need to be vigilant in identifying where there are pertinent discrepancies between the sampling frame and the stated population the sample is supposed to represent. It's also important to make sure you clearly understand what the actual sampling unit is for a given study. As I mentioned before, this is not always necessarily individual people, but it could also be something like a hospital or a specific class at a college. And we will discuss how to determine how many units are necessary to provide a representative sample in a later presentation, but it's important that you understand how many units there are. The sample size is often represented by a lowercase n. Now we get to the question of how to select individuals from the sampling frame to be included in the sample. We will spend the rest of the presentation discussing these different methods. There are a number of sampling methods, and we will only cover some of the most common in this presentation. These methods can be lumped into two broad categories. Those are unbiased or probability-based methods, and those that are biased or non-probability-based. For probability-based sampling methods, you will need to be familiar with simple random sampling, stratified random sampling, and systematic sampling. For biased or non-probability sampling methods, you will need to be familiar with incidental or convenient sampling, quota sampling, purposive sampling, snowball sampling, and mixed sampling. And we'll talk about each of these methods in turn. First, let's look at simple random sampling. This is one of the most commonly used methods, and it is very useful if you want to obtain a sample that, in the aggregate, is representative of many characteristics of members of the population. Simple random sampling is the method where every member of the sampling frame is given an equal chance of being included in the sample. The easiest way to think of this is by simply putting names in a hat, mixing them up, and then drawing out a certain amount of names. But this can also be done by putting lists of names into a random number generator in a computer and letting the computer randomly select however many names you want. And with sufficient sample size, a simple random sample, or SRS, can be used to generate an unbiased sample. But I note that I said with sufficient sample size. And that's where this concept of sampling error comes into play. Sampling error is where, based solely on random chance, there is a disproportionate amount of participants with a certain characteristic. Let's say, for example, there are 150 students enrolled in all sections of Health Studies 382, this class, in a given semester. And I randomly select 15 students. And it turns out, based on sheer random chance, that 5 of these students happen to be from Yellow Pine, Idaho. If we were to extrapolate this out to the whole class, that would mean that 50 of you are from Yellow Pine, Idaho. And Yellow Pine is a teeny tiny town in the mountains, and I am positive that there are not 50 of you in this class who grew up in Yellow Pine. But with a relatively small sample of only 15, it's somewhat likely that random chance will lead to some sort of sampling error, where a disproportionate amount of participants have a certain characteristic. and there's a greater potential for sampling error with a smaller sample size. So here is an example of simple random sampling. It varies a bit from semester to semester, but there are typically around 22,000 unique undergraduate and graduate students enrolled at Boise State in a given semester. And if we want to get a good average view of these students, we could just randomly select some number of them. Here I have a sample of 880, or 4% of the 22,000. We'll talk more about sample size later, but I'll say here that if it's a relatively homogeneous population and there are no specific subgroups within the population that we are especially concerned about being included in the sample, researchers can generally be quite confident that this sample of 880 is representative of the population as a whole in the aggregate. And I emphasize that this is in the aggregate or overall as a group. So with a simple random sample, you would simply identify 22,000 names of Boise State students and put those names in a hat, mix it up, or a computer program that does the same thing, and then randomly select 880 names. And that would provide you a simple random sample. But if there is a subgroup within the population you want to be sure is adequately represented in the sample, a simple random sample may not be the best option. This is where a stratified random sample would be a better option. Stratified random sampling is used to assure that members of the population within particular subgroups of interest are adequately represented in the sample. So with this sampling method, the population is divided into groups or subgroups called strata based on some characteristic of interest that's identified by the researchers. And then participants are randomly selected from within each of those strata. And there are two types of stratified random sampling: proportionate stratified random sampling and non-proportionate stratified sampling. I'll talk about each of these now. Proportionate stratified random sampling is where the sample size of each stratum is proportionate to the population size of that stratum. Let me provide you an example. Now here we have the example of how proportionate stratified random sample works. Let's say that you want to get a representative sample of all Boise State students. However, you are particularly concerned that graduate students be adequately represented in this sample. And out of the approximately 22,000 degree-seeking students at Boise State, about 3,000 of these, or 15%, are graduate students. So if you used simple random sampling to draw 880 names out of a hat, chances are that about 15% of these names, or 120, would be graduate students. But just based on random chance, you could end up selecting fewer graduate student names. And depending on the type of quantitative analysis you want to do, 120 names may already be a pretty small sample. So you run the risk of, say, only including 60 or 70 graduate students in the sample. And if the responses of graduate students are important to your study, that could be a problem if you're wanting to do robust quantitative analysis. So with a proportionate stratified random sample, you break the group into groups of interest called strata. And then you divide the sampling frame based on these strata and draw a sample from each stratum that is proportionate to the size of each stratum within the sampling frame as a whole. So with our sample of 4%, or 880 out of a population of 22,000, each person in the sample represents 25 people in the population. And we would want to keep the proportion within each strata the same. So we would randomly select 4%. So we would randomly select 4%, or 120, out of this graduate student pool of 3,000, and 4%, or 760, out of the pool of 19,000 undergraduate students. Accordingly, that's the advantage of proportionate stratified random sampling. The researchers are sure that the sample from each stratum is proportionate to the size of the stratum in the population or sampling frame. But as we will discuss in the next presentation on sampling size, depending on the type of quantitative analysis you want to do, 120 may be a perfectly sufficient sample size, but it may be too small for the analysis you want to do. For example, if in analyzing the data, you want to be able to break down this sample of 120 to further compare the experiences of graduate students in different programs based on gender, based on age, whether they're full-time or part-time students, or other factors, a sample of 120 may not be big enough to allow a robust analysis of subgroups. And by comparison, a sample of 760 may be larger than you need. So if you only have enough time and money and resources to sample 880, that's where disproportionate stratified random sampling may be helpful. So let's take a closer look at what this entails. With disproportionate stratified random sampling, the population is divided into different groups or strata, but the smaller stratum or strata will be disproportionately oversampled to make sure the sample is large enough to facilitate robust quantitative analysis. But this also means that when analyzing the data, the researchers must take into account this oversampling of the smaller groups by weighting the data. That's a lot to take in. So let's look at an example on the next slide. Let's go back to the example of drawing a sample of Boise State students. If we are especially concerned about getting a big enough sample of graduate students, but don't want to draw a total sample greater than 880, we are going to need to use disproportionate stratified random sampling that will allow us to oversample from graduate students. So to keep things with nice round numbers, let's say that we decide to draw 300 names from the graduate student pool and 580 names from the undergraduate student pool. As we will talk about in the next presentation, this provides us with a sample size big enough in both strata to do more robust quantitative analysis. And we can be pretty confident that the randomly selected 300 names here are representative of all graduate students in the aggregate, and that the 580 names from the undergraduate pool are still representative of undergraduate students at Boise State in the aggregate. But keep in mind, this means that each individual in the graduate student sample represents 10 people in the population, while each person in the undergraduate strata represents 32 people in the population. So the graduate students have been deliberately oversampled, and the researchers will need to take this into account when they analyze their data. That's where this process of weighting data comes into play. Here we have an example of the average or mean age of undergraduate and graduate students at Boise State. Now, because the university has all of the students' ages as part of the registration data, there really wouldn't be a good reason to get this information from just a sample. But let's ignore that fact for the sake of this example and say that the researchers sent out a survey questionnaire to this sample of randomly selected Boise State students and asked them about their ages. And for undergraduate students, the average age is 24. And for graduate students, the average age is 37. Now, if you want to calculate the average age for all Boise State students from this sample, couldn't we just take the average age from the 880 people in our sample? And the answer is no, we cannot, because we have deliberately oversampled from the smaller graduate student group. In our sample of graduate students, each person represents 10 people, whereas for undergraduate students, each person in the sample represents 32 people in the population. So we need to place more weight on the people in the undergraduate sample to reflect that it represents more people in the population. Specifically, each person in the undergraduate sample represents 3.2 times more people in the population than each person in the graduate student sample. You calculate that by 32 divided by 10. So here below is an equation showing how you can take into account this weight of 3.2 in calculating the mean for the total population. And you don't need to know this equation, but I just want you to see how this is taken into account, and you can see that that based on this sample, the average age for all Boise State students is 5.8 years old. And this is closer to the average age for undergraduate students because the data from the undergraduate sample is weighted more heavily. So that's disproportionate stratified random sampling. It's a very good and commonly used tool to assure that smaller subgroups of interest are adequately represented in the sample. However, the process of weighting data requires a bit more work when analyzing the data. And I imagine many of you will see studies in conducting your literature reviews for your paper that utilize some form of stratified random sampling. Now let's take a look at a form of sampling that you should still understand even though it is not very commonly used anymore now that truly random sampling methods are so readily available through computer programs. And this type of sampling is referred to as systematic sampling. With systematic sampling, participants are selected from the sampling frame at a constant interval. A couple examples may be selecting every fourth person sitting in a classroom, or selecting every 10th person on an alphabetical voter registration list. And if this were an in-person class, this is where I would ask students to discuss and figure out how the sampling in each of these examples could result in a biased sample. But being this is not a live presentation, I'll just show you on the next slide. And here is a bit of an extreme example, but hopefully you can see here how misuse of systematic sampling could result in a very biased sample. Let's say a researcher sampled every fourth person sitting in a classroom, and there happen to be 4 rows in the classroom. So when the researcher counts off every fourth person front to back, every person included in the sample happens to be in the back row, and the typical back row student may be very different from your typical front or middle row student. So this illustrates why systematic sampling cannot be considered a random sampling method. And here's another example. Let's say researchers want to pick every 10th name on a voter registration list until they get to the sample size of 500. That's probably okay if the list is 5,000 names long, because you'll end off with 500 people with names evenly distributed across all parts of the alphabet. But let's say there are 10,000 names on the list. By selecting every 10th name until reaching 500, the researchers will only get through the first half of the list before completing their sampling. So this means all participants will be from the first part of the alphabet. So this sample would be biased in favor of individuals from ethnic groups that typically have surnames at the beginning of the alphabet and wouldn't sufficiently represent people from other ethnicities. So researchers would need to adjust the interval to make sure that they draw people from all parts of the list by drawing every 20th name if the list is 10,000 names long and they want a sample of 500. But given how easy it would be just to put the list into a random number generator and use a computer to generate a simple random sample, that would be preferable. Because of how easy it is to create a simple random sample using computer software, systematic sampling is not used all that often anymore. But the term is still important to understand so you can recognize when you see a systematic sample and how to know that it may be biased. Used properly, systematic sampling may result in a good sample, but it cannot provide a truly random sample. So as a recap, there are 4 steps involved in selecting a probability sample. Number 1, define the population to be researched. And then identify the sampling frame from which members of the population will be drawn. As discussed earlier, the sampling frame should be as close to the population as possible, and differences between the population and sampling frame create a potential for creating bias. Third, determine the needed sample size. In the next presentation, we'll discuss sample size considerations. It's important for researchers to estimate their expected results and make sure the sample is big enough to obtain statistically significant results. This process is called power analysis. And finally, use the selected procedures to select the sample. So those are the probability-based sampling methods. Now we'll shift gears to look at the non-probability sampling methods. When comparing sampling methods, it's important to keep in mind that sampling methods are tools, so the important consideration is whether it's the right tool for the job. And probability sampling, like simple random sampling or stratified random sampling, is generally best in order to obtain a representative sample in quantitative research. But depending on the context and the study design, non-probability sampling may be appropriate. You will likely see non-probability sampling in qualitative research, in pilot studies, where the researchers are just testing out a particular study design, data collection tool, or something else to see if it's worth doing a bigger study later. Finally, and this is often with qualitative research, but research focusing on difficult-to-reach population may be another situation where you see non-probability sampling methods used. The first type of non-probability sampling to consider is what is called incidental or convenient sampling. And this is where participants who meet the inclusion criteria for the study are selected based on accessibility and proximity to the researcher. In other words, you select a sample that is convenient to find. This may include intact groups, such as pre-existing classes, work sites, or workplace departments. Grab sampling, where you just ask people in the street, stop people at the mall. And volunteer sampling, where you ask for volunteers. And hopefully you can see how all of these may result in a biased sample. Let's say if you use intact groups consisting of people enrolled in a class that meets at 10 a.m. on Mondays, Wednesdays, and Fridays in person on campus, this sample would probably not adequately represent many distance learners, students with full-time day jobs, and students enrolled in online classes. But if there are circumstances that make it impossible or not feasible to obtain a random sample, convenient sampling may be a helpful tool. The next non-probability sampling method we'll discuss is quota sampling. And this is the non-probability equivalent to stratified random sampling. Here the researchers set a quota for participants with certain traits and then non-randomly select participants until those quotas are met. In this way, quota sampling is kind of the non-probability equivalent to stratified random sampling. Let's look at an example. The researchers stand on a street corner to survey 40 people about eating habits. They want to distribute the short survey to both males and females and married and single individuals. Now, the fact that the researchers are selecting participants just by standing on a street corner should scream to you that there is going to be a biased sample. For example, if the corner is right in front of a McDonald's, you're likely going to find people with very different eating habits than you might find in front of a health food store like the Boise Co-op or Whole Foods. But perhaps the researchers just want to pilot the study to test out the survey instrument to make sure the questions are not confusing. So to assure that they get an adequate response from each group, they might set a quota of 10 each. And they would give the survey to 10 single men, the first 10 single women they meet on the street corner, the first 10 married men they meet, and the first 10 married women they stop. The next non-probability sampling method you should be aware of is purposive sampling. And this is where the researchers select participants that the researchers judge to be typical of individuals within a given group or with a given trait. This is also sometimes referred to as judgmental sampling, and it is commonly used in qualitative research. And as we'll discuss later in the course, qualitative research necessarily requires that the researchers use a fair amount of subjective judgment. Let me give you an example. Let's say researchers want to qualitatively investigate the advising needs of Boise State health science students with a focus group of a dozen or so current undergraduate health science students. And so they may try to select students with traits that reflect the breadth of students in the health science studies program, both men and women, full and part-time students, students with differing GPAs, students just starting college and those nearing graduation, and so forth. And using their judgment, their subjective judgment, the researchers would try to compile a group that is typical of health science studies students as a whole. Finally, snowball sampling. This is also sometimes called chain sampling, and it is a multi-state sampling method in which initially contacted participants are asked if they know others with the same characteristics who would like to be included in the sample. And this method is especially useful when researchers when researching or investigating a population that is difficult to identify because of the sensitive nature of the research problem. Such populations may include street gang members, illegal drug users, sex workers, patrons of sex workers, and so forth. And from a public health perspective, these are important populations to research, but individuals in these populations would be difficult to identify and locate using other sampling methods. But if a researcher has built rapport with and has developed one or two contacts in such a community, the researchers could ask initial contacts for others to participate in the study. And as with other non-probability sampling methods, this method is often used in qualitative research. Specifically, this type of sample is often used in a subset of qualitative methods called ethnographic research, which has its roots in anthropology. With ethnographic research, the researcher will observe individuals within their culture or environment. Thank you for your attention during this first presentation. In the next presentation, I cover basics of sample size.